Next, I will go ahead and assess range of motion of my lower extremities. I have a minor and a major. So for my minor extremity, I will be assessing range of motion of my patient's ankles. And for my major extremity, I will be assessing range of motion of my patient's knees. So to assess range of motion of my patient's ankles, I can do movements such as plantar flexion and dorsiflexion. So for plantar flexion, I can have my patient point their ankles down, and then dorsiflexion is pointing up, plantar is pointing down, dorsiflexion is pointing up. So if my patient is able to complete those if my patient is able to complete those range of motions in both ankles, I will note that my patient has full range of motion bilaterally in their ankles. I can assess range of motion in their knees by having them extend and flex their leg, and then that can also extend and flex their knee. So what I'll do, I'll have my patient extend, and then I can have them flex. So extend and flex. Alright. And if my patient is able to complete those movements without any signs of resistance or pain, I will note that my patient also has full range of motion within her knees. So I would assess that in both legs, assessing extension and flexion in the knees, and assessing plantar flexion and dorsiflexion of the ankles. After that, I'll go ahead and move on to assessing the sensory function in my patient's lower extremities. So by doing that, I'll have my patient basically identify between a dull, and a sharp object. So I can have a safety pin or a paper clip, and I will lightly prick on my patient's lower extremities, such as their legs or their foot or their ankle. And basically, I would just have my patient just basically tell me the sensation that they're feeling, if it's a sharp or dull pain, and that will assess and note that my patient has full sensory function of their lower extremities. After I have assessed for sensory function, I'll go ahead and move on to muscle strength. So when I'm assessing my patient's muscle strength, I'm assessing their muscle strength of their upper and their lower extremities. So one way that I can assess for muscle strength of the upper extremities, I can have my patient reach out their arms, and I can basically just try to use force and push down on them. The same I can do for lower extremities. I can do the same thing for their legs. I can have them stick out their leg, and I can use force to push down on their leg, or I can have them do a position of putting their foot in a dorsy position, and I can kind of just like press back on their foot. And basically, if my patient is able to assess that my patient has a muscle strength of 5, it would basically mean that my patient is able to resist against me creating force. So if my patient is able to do that, I will note that my patient has a muscle strength of 5. After that, I will go ahead and assess my patient's gait. I'll have my patient walk across the room, and I can assess their gait, and I can look for and note that my patient has an even and steady gait, and they're able to walk independently with no signs of assistive devices. They're not tripping, they're not stumbling over their feet. And if my patient is able to do that, I will note that my patient has an even and steady gait, and that they can walk independently with no signs of assistive devices. After that, I would end the assessment with Roth. I would go ahead and reassess my patient's pain level. I would ask them to score their pain level again on a scale of 0 to 10, 0 being no pain, 10 being the worst pain. I would offer any comfort measures, such as if my patient needs a blanket or water, if they need their phone. I would make sure to put the bed in the lowest position and make sure that the bed is locked. I would put the bed rails up, and I would make sure that my patient has their call light in reach. I would answer any questions that my patient has about the assessment, or as far as maybe their health. And I would also thank them for participating and cooperating as I completed my assessment. And I will go ahead and end the assessment with hand hygiene. Thank you.